Each year, between 5 and 20% of the population gets the flu. It's a respiratory illness that infects the nose, throat, and lungs, if that sounds like what we've been talking about for weeks and months, because symptoms are very similar, if not identical, to coronavirus, with the only big difference being the loss of taste and smell.
And with COVID-19 still around, parents are worried about tackling both this winter. So what can you do to best protect your child from COVID-19 this flu season? Julia Fellow reports.
Coronavirus will be a new battle we face this flu season, and while social distancing is in effect, there are still close carriers to stir the confusion.
That's all you need to get influenza around your community as kids in school.
So how can you protect your kids? Doctors say it is important now more than ever to get a flu shot.
It's not only to protect ourselves, it's to protect the people around us that we care about.
That point stays true even if they have already had coronavirus.
There's a good chance you may have some lung injury, and we don't want to add influenza lung injury on top of that.
There is still the need for children to stay socially distant.
Is cohorting, keeping children in small groups, so that if one child in the group gets infected, it doesn't infect the whole classroom.
And be sure to establish a daily routine with your children. Give them a spare mask and hand sanitizer for the day. And it will only work if you remind them how to practice safe health habits, such as reminding them to only touch the non-cloth parts of their masks.
And remind them to wash their hands throughout the day as well. And when they return home, keep their shoes at the door and wash their clothes after one wear. Julia Fellow, TMJ4 News.